Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician here in Hickory, North Carolina, and today I want to answer a common question that we hear, and that is, what is the best type of doctor for back pain? And here's the thing you need to understand. It is you need to see the type of doctor that is most appropriate for the problem that you have. Okay, because there's a lot of different types of back problems, and there are a lot of different types of doctors that you need, they're more appropriate for each one of those. Now, if you have problems like a disc herniation, which is the spacer between the spine, if you have a spinal disc herniation, a slip disc, if you have spinal arthritis, if you have generalized back pain, if you have a pulled muscle, if you've had an accident and you have whiplash injury, or you have other soft, the tissues that support the spine, that's something that's very appropriate for a doctor of chiropractic. Okay. Now, even if you have a problem and you're not sure what's going on, which is where most people are, still seeing a doctor of chiropractic is a great portal of entry doctor to see for evaluation of these injuries to determine what needs to be done next. I routinely work up cases where people just have back pain and they're trying to figure out what's going on. So what we help them do is we help triage them, figure out what's happening, where do you need to go, what's your in your best interest. There are a lot of problems that we can help people with, even if it's something that may need surgery. So we work a lot with spinal injuries. We work a lot with disc herniations, and now sometimes disc herniations need surgery, guys. They just do, and thank goodness we have that as an option. But a lot of times, depending on the severity of the disc herniation, we're able to work with people to significantly improve their pain and help that disc heal and avoid surgery. So that's it's really important for you to understand. Excuse me. It's very important for you to understand that it depends on what type of problem you have. But if you need a spinal surgeon, you need a spinal surgeon. If you need a pain management doctor to help decrease some pain, then that's what you need. But most problems need to be and are like conditions like disc herniations, a lot of things I'd mentioned earlier, they need to be worked on conservatively first. Because remember, when you take steps towards using more invasive procedures, medications, injections, and surgeries, they're more risky, there are more potential side effects, and once you go in and you start making changes to the anatomy of the spine, you cannot go back. Okay, you cannot change it. Once you've had surgery, you cannot change it. So what we try to do is I try to help people figure out what's most appropriate. If I think there's a chance that we can help, then we will initiate a trial of therapy, and we'll give it enough time to evaluate whether or not this is going to be a successful approach for you to take. I'll do the best that I can for you. That's all I can promise. But the type of doctor that you need to see is really dependent upon the problem that you have. So if you would like for me to take a look at your case, give you my opinion on whether or not I think I can help, or just help to give you some direction on who you might need to see, I'd be happy to do so. Just give us a call at 828-324-0800, and my staff will be happy to schedule an appointment for you. You can also visit us online at hickoryspine.com to learn more, but I hope this has better helped you to understand what type of doctor you might need to consider seeing with your back pain. And if you have any questions, don't hesitate to reach out to us. But I hope you have a wonderful day. Thanks.